Endometrial biopsies it's an office procedure meant to evaluate women who are having bleeding after they have entered menopause, or women who are having irregular bleeding leading up to menopause. The main goal is to make sure that there are no abnormal cells involving the lining of the uterus. And so I like to describe an endometrial biopsy as a very scaled down version of a DNC, dilatation and curettage. So when we do this procedure, I usually will ask my ladies to take ibuprofen before the procedure to help with cramping. And then a speculum is used to be able to see the cervix. We clean the cervix off with betadine, which is an antibacterial, and that helps to cut down the risk of infection. In some situations, we will inject lidocaine into the cervix to help with cramping, also to help with any discomfort that might occur when we attach what's called a tenaculum to the cervix. And the tenaculum is meant to hold the cervix in place. So this is a diagram of the uterus. The endometrial biopsy is used to assess this inside cavity of the uterus. This is where the lining builds up when we are having periods. Technically in menopause, it should be thinned out, so there should be no bleeding. When there is bleeding in menopause, we have to make sure that there isn't any worrisome cause for this bleeding to occur, and that's the purpose of the endometrial biopsy. We sometimes have to dilate the cervix, and then we place the pipelle, which is the instrument used to do the biopsy, up into the uterine cavity. It is a very thin instrument measuring about 3 millimeters, and there is a way to create suction with this instrument. And so the goal is to obtain tissue involving the entire uterine cavity. So it's not just little snippets here and there. We go from top to bottom and we go in a circular motion and get as much tissue as we can so we can make sure we have a good biopsy. This tissue is then sent off to the pathology lab, and it takes anywhere from 4 to 7 days to get the results back. The recovery time from an endometrial biopsy is very quick. I usually ask my patients to avoid placing anything in the vagina for 3 days, 72 hours, and that includes avoiding swimming and hot tubbing, and this is all to decrease the risk of infection. Typically, cramping occurs during the procedure, but once the procedure is done, and it takes about a minute or so, cramping resolves and you can go on about your day, including exercising and driving. Most women can drive themselves to and from this appointment.